My name is Patrick Hanna. I'm one of the family physicians at CCM Health, who also practices obstetrics. I include Waterbirth in my practice because it's a service that patients are actively seeking out and looking for, and it's not readily available in our area. And then there are numerous advantages to Waterbirth that a patient could potentially benefit from. A Waterbirth is a great option for somebody who's looking for a low intervention birth, somebody who wants more of a natural type of birth. And the environment is often very calm and relaxed. And so for a low risk, motivated patient, it really can be a nice option.
My name is Jane Wrede, and I'm a nurse midwife here at CCM Health, and I've been here for about 4 years. A lot of women choose Waterbirth because they want a physiological birth, and we found that it decreases the need to use Pitocin, probably because it lets them move around more freely, just less monitoring, and we also have found that it decreases the laceration rate as well, and that really aligns, I think, pretty much with what the research shows as well. So I think Waterbirth is a safe option for women who are low risk. Women aren't monitored quite as closely in the water. They can move around more freely. We can do intermittent monitoring because we try to screen women really well and put low risk women in the birth tub.
So for individuals that don't have high blood pressure, gestational diabetes, they're not on IV medicines like IV magnesium sulfate and other medications.
The water during a Waterbirth delivery is generally clear, and a lot of patients ask that question as they start to think about Waterbirth and prepare for Waterbirth. What will the water look like? And in general, it's clear, and it's not pink colored until the placenta is ready to be born, which is about the time we get women out of the tub.
So babies have what's called a dive reflex, and essentially what that means is that when they're underwater, they're not going to take a breath. So the things that stimulate the baby to take its first breath are exposure to the air. So after a baby is born in the tub, we help guide the baby up to the surface and place the baby onto the mother's chest, and then the baby will start to breathe. So I think the importance is to educate yourself, to take advantage of our prenatal classes, to read about Waterbirth, maybe watch some YouTube videos, and then also to have a tour of the birthing room with the Waterbirth tub, just to kind of gain familiarity. It really does take a motivated individual to have an unmedicated birth. So I think the more that you can prepare yourself and in advance make sure that you have an appropriate partner who's there to support you, that you've practiced breathing techniques, all of those different modalities that are going to help you have success for an unmedicated Waterbirth.
In the beginning of the 3rd trimester, we start a birth plan. We explore all of the options around pain management, which can include pharmacological agents, but also non-pharmacological agents. So potentially getting up and moving, getting in the water and doing what we call hydrotherapy, not necessarily birthing in the water, but laboring in the water. Women also will try lots of different stretches to optimize the baby's position so that hopefully labor will go a little bit faster as well. But it really begins with a birth plan, and then from there we follow their lead as far as what they're looking for in labor. So the temperature of the water has greatly improved over the last year because we have a brand new tub. And that tub has really been installed in the hospital plumbing, and so we can keep the temperature exactly where we want it. Prior to our new tub, we were using an inflatable tub, which created a lot of challenges as far as keeping the water warm. But it's pretty exciting. Now we are connected to the hospital plumbing, and we can raise the temperature and lower the temperature as we need it, which is around the body temperature, so around 98 to 100 degrees.
So our staff is trained to adapt and to address any emergencies that come to be while a patient is laboring in the tub. But if there is an emergency or a situation that arises that would mandate it, we would assist the patient up out of the tub and move them back to the bed where we could further take care of and manage whatever problem is going on. So after the baby is delivered and we put the baby skin to skin with the patient, we wait a few minutes. Generally, we employ what's called delayed cord clamping, where after a minute or a few minutes and the cord stops pulsating, then we'll clamp and cut the cord. And then within generally a few minutes after that, I would say we want to assist the patient up out of the tub with the baby, move the patient to the bed. Then deliver the placenta, assess for any lacerations that might need repair. So I would say after birth, on average, maybe 5 minutes in the tub, and then we're moving to the bed to deliver the placenta and to take care of those other issues.
The depth of the water in the Waterbirth tub is a little deeper than the tub in our regular labor rooms. We like it to be a little bit deeper, probably chest deep, because we want women to get the buoyancy of being in a little bit deeper water, because when they're buoyant, they can move a little bit more freely and their pelvis can move a little bit more freely, which might contribute to the speed of their labor.
I would recommend that a patient wear whatever is most comfortable. And for some individuals, that might mean they're wearing a sports bra. Others may choose to be completely without any clothing. So it's just something to think about and select what you feel is going to allow you to be the most comfortable when you're in the tub. I think it's important, if a patient is interested in a water birth, that she discuss that with her physician or her midwife. There are things to review. There's a consent form that I would like my patients to review and sign well in advance, so you don't want to come into the hospital in labor and then decide you want a water birth. This is something that should be discussed in advance, talked about, consent reviewed, consent signed. And then, as I talked about earlier, educating yourself, taking a look at the tub and the room. I think all of those factors are really important.
I think patients need to know that Waterbirth is an option for them here at CCM Health. It's completely driven by their desires and their needs.
So when a patient is in the tub at any moment, if she decides that this is not how she wants to continue to proceed, there's always the option to shift gears and to go a more traditional route, whether that's an epidural or other pain management options. I've had patients who've been in the water birth tub before and they've said, nope, I'm ready for an epidural. And then we need to have that flexibility, and we need to be able to accommodate the needs at any given moment. It's extremely important for patients that elect to have a water birth that while laboring in the tub, there's always somebody there in attendance with you. Ideally a staff member, but if a staff member has to step out of the room, that there's a partner or a good support person there in case there's an emergency that we're readily able to intervene.
I like to recommend CCM Health for delivery because I think that we have fantastic nurses. We have a great group of doctors. We have nurse midwives who all together, the whole entire team is committed to making your birth experience a fantastic one.
Delivering in water definitely helped my body relax in such a way that the pain, especially my third and fourth deliveries, Walter is our third baby. And when I was delivering Walter, I just remember specifically stepping into the water and feeling everything just almost take a deep breath, where it helped my body slow down, take a minute, regroup, and then I was able to focus on moving through the labor process into delivery process in a way that just eased everything, where it felt less intense. It's still intense, but it felt less shocking, if that makes sense. If someone is thinking about having a water birth, I think the biggest thing to kind of release from your mind is that it's going to be unclean or it's going to be dirty. I think there can be an idea that water birth is really messy, but I personally think I felt like it was a cleaner process than traditional birth because your body relaxes. It enables your body to, for me anyway, release that baby. And even in the initial afterbirth, the water is clean, and it allowed for me to just rest in the water and relax and hold that brand new baby. So I've had 2 traditional births and I've had 2 water births, and I would hands down choose a water birth over a traditional birth for so many reasons, but specifically stepping into the tub during that labor and delivery process, my whole body relaxed and it allowed me to deliver that baby in such a more, I felt like my body, all the tissues of my body were ready for that baby to come versus feeling like I was forcing that baby out when tissues weren't ready for that baby. But the postpartum recovery after a water birth was distinctly different than traditional birth, and so much less pain, so much less discomfort, and the healing process was so much faster for me. And I think you would even agree in terms of how you noticed me recover.
Oh, absolutely. Yeah, I think the pain levels were postpartum were much less. And yeah, you were almost doing the normal daily routine within a day or 2 after the water births versus the traditional.
I would recommend CCM Health for both traditional and for water birth so much, because as a woman delivering a baby, you feel heard, you feel personally cared for, and I truly have experienced that what is important to me and what is important to us is important to the staff, and it has made for such a positive experience on so many levels.
And it's been a great experience here with the three of our kids, and yeah, we really appreciate the staff here and the way they listen and they hear us, and that goes a long way.
If you are thinking about having a water birth, it's worth trying. And if you decide in the process that this isn't working, there's a bed next to you that you can use. But if you're thinking about it, water birth is truly an incredible experience, and it's a way that you can connect in that labor and delivery process and bringing your baby into the world in a much more hands-on way. And I loved that